So today we are going to talk about cardiac anatomy and physiology, just revising what we studied earlier, which can help for study the medicine part. Okay, so in the cardiovascular system, we have three things we have to remember. One is heart, one is heart. Okay, already it is given here. Okay, and the accessory organs which help to move the blood from the heart to the body parts, from the body parts to the heart. Okay, so those are arteries, veins. Other than that, we have lungs, which help oxygenated to give oxygenated blood to the body, and do the it will remove the carbon dioxide from the body. So this is the main thing we have to remember. So basically, uh, we need every cell need two things. One is oxygen and another one is energy. Okay, then only they will work, their function will utilize. So heart is the pumping organ. Okay, its work is only to pump the blood to the several parts of the body. Okay, then they easily get the nutritions to form the energy and oxygenated blood oxygen. Okay, so these are the things we have to remember. Other than all the accessories which helps. Okay, so in the blood, we have blood, nutritions, hormones, oxygen, and other gases. Okay, you can see that there is the heart is situated in the mediasternum. It is the ribs. Here we have the mediasternum. Okay, you can see the cone shape. Okay, so it is mostly left side is its large area is it is present in left side of the chest cavity, and it will never stop. Okay, always contraction, relaxation. So its main function is to send the blood to the target area where the exchange of gases occurs, exchange of nutrition occurs. You will give the oxygenated blood and you will take deoxygenated blood. First thing. Second thing is that you are giving nutrition and energy and metabolism will happen. Then the products after metabolism, the waste products will come into the venous drainage. Okay, so this will happen. So the main purpose is to bring back the waste products, give the healthy products. Okay, so in the body we have 4 to 6 liters of blood, okay, which will circulate continuously. Okay, and it is the blood within the vessels, within the heart, and within the capillaries, within the venules, arterioles, everything. If we come out of the vessels, it will clot and it will harm to the body. Okay, so there's the reason we have platelets. Okay, to protect the body. Okay, so you can see that heart ventricles will pump the oxygenated blood, arteries collect it, arterioles collect it, then capillaries from the organ utilizes and give the waste product to the same capillaries to venules to veins to heart atria. Okay, you can see that this is the heart. We have that in here: right atrium, left atrium, right ventricle, left ventricle. Okay, so here the bluish color right side of the heart have deoxygenated blood, which is coming from the upper part of the body, lower part of the body into the right atrium. After that, it will go into the right ventricle, then from the pulmonary artery, the lung. will become oxygenated blood and will come again into the left atrium to the pulmonary vein and come into the left atrium after that left ventricle, from the left ventricle to the aorta, aorta to the all the body parts. So we have valves, chambers, four chambers, okay, atrium, ventricle, right and left, okay, and we have valves. You can see that this is the right tricuspid valve. It is because three level of doors are there, so that's the reason we're calling tricuspid valve. In the right side, left side, we have bicuspid valve, okay, and in the artery, in the we have, this is the our pulmonary artery have the valves, okay, pulmonary valve. In aorta we have aortic valve. So this is the thing we have to remember. Next we have the coronary circuit, coronary artery and coronary vein. You can see this is the uh, diagram. You can see easily, okay. So this is the large atrium or artery. From that we have the, you can branches, right coronary artery, left coronary artery, okay, and it will give the distal coronary artery, left anterior descending coronary artery. So yeah, these are this which will pump the heart, the blood, and you have the vein. This is the vein, okay, and you have cells, okay, in the SA node, AV node. They are called specialized cells, okay. SA node means sinoatrial node. It is present in the atrium. AV node, it is present with the atrium and ventricle between. Okay, these are the pacemakers. We generate electricity. From the SA node, it will go to the AV node. From the AV node, it will go to the bundle of branches. And here we have, you can see Purkinje fibers. Then the heart contract. If it is contract, it relax. It contracts, it relax. This will happen. Okay. You can see the SA node general 60 to 70 impulse. AV nodes 40 to 60 and ventricles below 40. Okay, and you have the one cardiac cycle. Okay, means here contraction and relaxation. The blood release from the heart, the blood enter into the heart. This whole condition is known as cardiac cycle. Simply, you can see that this is the uh, contraction, ventricle contraction happen. Will go to the aorta, pulmonary artery. Okay, okay, here the ventricles will happen, and gradually the atrium contraction will happen. Startle, it ends here. Okay, so this, all this is known as, you have that cardiac cycle. So basically this is the wave which defines the one cardiac cycle: P wave, Q wave, R wave, S wave, and T wave. So this is not, if this is okay, everything is normal, means your heartbeat is normal. So everything is going as per the functional issues, not functional issues. Okay. So you can see systolic means it is a contraction, diastolic means relaxation. Systolic means contraction. You need more force to pump the blood into the target area. Okay. So contraction. Then relaxation. It doesn't need any type of more, a large amount of energy for relaxation. Systolic is normal 120, diastolic is 80. You can see that. So this is the everything here explained. Okay, and we have the cardiac output. How much amount of blood eject per minute? Okay, so here means it will eject for 1 minute 5 to 6 liters. Means once 1 minute, the whole circulation of blood will happen in 1 minute. Okay, so these are the very important. So we completed here diastolic, systolic, and we have the other things related. And ask me. anything related anatomy and physiology. We talked about the structure, the areas, the cardiac cycle, okay, and everything related to the heart, which is only for revision purpose. Okay. So any doubts, kindly ask.